So a great place to start with learning how to engage your core properly is laying down, because that way you eliminate the gravity aspect. So it's a little bit easier to start with that, and this is what I usually suggest to patients. So what you want to do is you want to try and get a bit of a posterior pelvic tilt, gentle, and gently push into the back of the bed, while at the same time trying to elongate, there you go, through the rib cage, and making sure that you're supporting that rib cage. Gentle pelvic posterior tilt. Try not to engage the glutes. Bring that rib cage up a little bit, and try not to use your accessory muscles. There you go. You want to make sure the shoulders are nice and relaxed, and you're getting most of the work from the deep core muscles, transversus abdominis, as well as pelvic floor muscles. So next position that you want to try and practice your core engagement, once again, you want to make sure that you engage your core during your functional movements, sitting, lying, standing. So what you want to do is you want to, when you're sitting, you want to still get a little, there you go, a little bit of that posterior pelvic tilt. You want to get nice and tall through the rib cage, at the same time not using your accessory muscles. There you go. Try and get a little bit of it. Excellent. That's perfect. That's good positioning, making sure that the rib cage is supported. The rib cage is not tilting forward. As a result of that, you're going to get more strain on the neck. The shoulders will come forward, but if the rib cage is nice and tall, the shoulders automatically go a little bit forward, and you don't even need to drive them too far. There you go. Neck position's good. Once again, sometimes you can see with this patient, she's flaring the rib cage a little bit. There, that's it. There you go, perfect. So we don't want that rib cage flaring up this way either. And once again, you want to hold that for about 10 to 15 seconds and try to do it 10 to 20 times a day. Ideally, when you're sitting, working, try to remind yourself, get a little sticker on the computer to engage your core, and hold it for 10 to 15 seconds. And the goal of this is to try and get you to do it for a longer period, so that it becomes automatic in your brain to do it when you do sit. So next position where you want to try and practice your core engagement, which will help with your overall core strength, is in standing. So what you want to do is, once again, tilt the pelvis a little bit gently, a little bit of a gentle posterior pelvic tilt, nice and tall through the rib cage. There we go, exactly. Try not to flare that rib cage forward, nice and tall. There you go, engage the belly button, especially these muscles down here you gotta try to work on getting these guys activated. Try to press in a little bit. There you go, that's it, nice and tall. Breathe. There you go, good positioning. Once again, especially if you're standing in one spot for too long, you want to try and work on this one, and try to keep it engaged for about 15 to 20 seconds. And once again, you should be able to breathe when you're doing this type of exercise, because the breathing comes from the lungs, is separate from the core exercise, core muscles, which are stabilizing your, there you go, excellent, there we go. Keep the core engaged, excellent. Good, shoulders are, because once again, when the ribs are in a good position, chances are the shoulder and the neck, they're going to be in a good position. But when the ribs are down, everything goes down. But when the ribs are supported by the core, this canister here is all full, that gives you the support up top. So now I wanted to show you guys, when you are doing your upper body workouts, like I say, regardless of what you're doing, you still want to try and engage the core and make sure that you're stabilizing the core, making sure that the back muscles are safe. And also, if you are looking to isolate, it's a great way of isolating the upper body. In this case, we're going to be doing a shoulder press. It's a great way of isolating and making sure that the back is not arched, and you're not getting biomechanical advantage from the back in order to lift the weight up. So as a result of that, what we're going to start is, before you even lift the weight, we're going to get you to engage the core. Same concept as you were practicing when you were just standing. Belly button, there we go. Little posterior pelvic tilt, a little bit more, engage the core, nice and tall, good. Keep that positioning. And now we're gonna add a little bit of weight. Let's get you to press that up while you're maintaining the core. And up. See, once again, there's a little bit of flare here. There. There you go. Keep going. As you can see, she's trying to flare up because it's easier on the shoulders, whereas if we keep, there we go, keep that rib cage stable. Excellent. Breathe. Inhale, exhale down. Good. Inhale, exhale down. Good. One more. Down. Good. And relax. And in this case, the 10 pounds usually for her is not a big deal, but as soon as she tries to engage that core, she tries to stabilize everything, she's not getting the biomechanical advantage from the low back. And what she's doing is she's isolating the shoulders and creating that good positioning where you really get the shoulders rather than the pec muscles working. As a result of that, even the 10 pounds was probably a bit much if she's in that good optimal position where the core is engaged and she's working the core and the shoulders, which is a 2-in-1, which is what I suggest to every patient when they are exercising in the gym. Try to engage the core because you're gonna get 2-in-1. You're gonna get the core engagement, core strength, stability, saving the low back, and also focusing and isolating the upper body, which in this case is the shoulders. The patient is working on lower body exercises. Same thing, if you're working on lower body exercises, before you start anything, what you want to do is, there you go, get a little bit into that posterior pelvic tilt, engage the core. It's the same concept. Bring the rib cage up, stabilize. There we go. Once you're good there, stable position. And then once everything is engaged, the core is engaged, what you want to do is keep that core engaged throughout the movement, throughout the exercise, whether you're doing 10 repetitions or 8 repetitions. We'll go for about 3 to 4 here. Let's get you into that squat. Try and engage the core, keep the core engaged, and up and down. You don't have to go as low, up, and you don't have to go as, that's it right there. Good. And again, up. One more, and up. And the great thing about this is if you're keeping that core engaged, you're once again eliminating the low back and you're focusing in on the hips and the quads to do most of the work, while the low back is staying stabilized via the core, and it's not arching, it's not getting into an arch position. Also, your rib cage is not going forward when you're squatting, so it will help stabilize everything up top and allow the hips and the knees and the quads to do all the work. But at the same time, it might be a little bit more difficult where you're not going to be able to lift as much weight. So these are exercises where once you engage that core, you're not looking to lift a record max amount of weight, but rather you're looking to isolate and work on specific areas which these exercises are designed to do.